Another question from our audience: what is the average recovery time after this surgery? And I would pose it to both Kyla and Dr. Weigel.
Well, as Kyla said, the average length of stay for this procedure now is approximately 2 days. We keep fairly accurate records of all of our patients. We participate in what's called the Society of Thoracic Surgery thoracic database, and so we know pretty precisely how many patients actually do go home with chest tubes, and it's actually closer to, it may feel like 10%, but it's actually closer to probably about 3% of the patients. You always want remember the ones that do and forget the ones that don't have to go home with the tube. But most patients really don't complain about having the little, what we call mini 500. It's kind of like a pocketbook, and they tuck it in their pants, or they have all sorts of ingenious ways to carry that thing around for a couple of days. But the recovery, I always tell patients, we're not operating on your legs. I do expect them to be up walking the night of surgery. And if they're not, we ask them why. And if it's pain, we fix it, because it's extremely important that you get up and get going. Most patients are home in approximately 2 days. And many patients, depending on what they do, how physical a job they do, can be back in work in a week or two.